So this is my speech that I prepared about coronavirus, how it started. The coronavirus disease, also known as COVID-19, is an infectious disease caused by a new strain of coronavirus. On 30 January 2020, the Philippine Department of Health reported the first case of COVID-19 in the country with a 38-year-old woman Chinese national. As the cases of COVID-19 continue to grow in the Philippines, the level of inequality in the country has become increasingly clear. As early as late February, it was more or less business as usual, and then almost overnight, all kinds of business started shutting down, left and right, as social distancing and stay at home measures were become increasingly enforced across the country. Grocery stores have been rare exceptions to this rule, deemed as essential business by local, state, and federal authorities. They have been operating around the clock since the threat of COVID-19 became more ominous with each passing day. The start of the enhanced community in the quarantine in the Luzon signaled the beginning of the catastrophic impact of the pandemic on Philippine economy. A large number of workers were placed in a no work, no pay arrangement as business went on first break. Thankfully, donations quickly flooded, but there are still difficulties in finding ways to hand them over as cash donations to the people. COVID-19 is doing damage to the Philippines as well. The Philippine GDP growth has averaged around 6% annually for the past decade, but it could actually contract this year. As many as 1.2 million Filipinos could lose jobs as the economic dives and as lockdown limits economic activity. Meanwhile, many Philippine health authorities question the necessity of conducting mass testing, claiming it is unrealistic. They also failed to establish a robust nationwide infrastructure to combat the spreading of this epidemic through proactive testing and large-scale contact tracing and targeted the quarantines of most affected areas. Hospitals have a voice over what their workers do at work, but less than one when it comes to what they do after they quit. But in the case of COVID-19, what healthcare workers do during their shifts affects the people they interact with when they do. We know that hospitals are improving infections prevention procedures that help to keep patients healthy, such as hand washing and etiquette distribution of protective clothing. There is currently no magic drug or treatment for COVID-19, and there is an urgency to find effective treatment. The drugs included robust data is needed. We should be optimistic that this mega trial with over 90 participating countries will promote the rapid generation of strong evidence for treating COVID-19 and ultimately stop this pandemic. So this is my speech about the coronavirus, how it started, and thank you.